hospital to have this beautiful, healthy baby. We bought a new house to fill our growing family. And instead, we ended up with a sequence of so many errors that was, as you all talk about, this lineup of the holes in the Swiss cheese. And I'm going to dedicate my life and his life that was lost to trying to fix this problem, to trying to create more transparency around the harm that exists, to try to culturally get more people in healthcare open to this notion of non-perfection, open to this notion that we can make mistakes, but maybe we should track them, learn from them, improve them, compare them across industries, across our system, across multiple systems to identify where we are relative to our peers. We are drowning in hospitals in a sea of data, but we are not effectively using the algorithms to make sense of this data. Leapfrog is going a huge way in helping making sense of that data, but you're still all doing too many surveys, filling out too much data, and we don't have, like we do have in other industries, the right data integrators to make useful algorithms. Here I am saying, thank you for this work, but we have to do more, and that's me with my son Mac. I think we should say, I can guide you to a hospital that's going to provide safe and consistent and high quality care. And I can guide you as your family member, as your healthcare plan, as your employer, because I have access to that data, because I'm confident in that data's integrity, and because it's accessible to me in a way that will be meaningful and useful. So for me to achieve the kind of healthcare that I'd like to see my sons get, it involves you going out there and pushing harder, doing more every day, and challenging the status quo.
In August of 2005, my dad, who was then 76 years old, he was healthy enough to actually mow his own lawn the day before and had stayed away from doctors his whole life. He fell down the stairs at home one night, getting up to use the bathroom. He injured his neck, and the surgery to repair his fractured vertebra in his neck actually went very well. But he ended up having a series of cascading medical mistakes that included a C. diff infection that ruptured his intestines. And at the end of those 6 months, he seemed to be getting better, but overnight he was found barely breathing in his bed by the nurses. And we rushed to the hospital, and by the end of that day, we agreed as a family to take him off the respirator. This stuff, as we know today, that medical harm happens and that infections happen is hiding in plain sight. And as a reporter for most of my life, I felt people needed to know about this. We need to give patients an opportunity to become more than an N of one. Historically and culturally, though, until very recently, doctors have been tangoing alone. They've been pushing us patients around the dance floor, while we patients historically have been pretty passive. We've been pretty okay with that. We need to intrigue and entice people of all demographics, literacy levels, and cultures to activate and engage as patients to the extent that they want to. The Patient Voice Institute is working to aggregate patients as a market force. We want to create one central place where every one of the 35 million people that go in the hospital every year, if they so choose, can tell their experience. They can do it in a succinct and meaningful way with the assurance that the data derived from it will help to drive system improvement. And we've been calling this a trip advisor for the patient experience, with patients sharing what they know freely on their own terms.
One of the most important things to keep in mind right now is that there's never been a more opportune time to try to affect change in the United States. These are changes aside from the insurance reform. What we hear all about Obamacare and insurance and coverage and that sort of thing, but some of the most important things that are happening as the federal government is playing this increasing role has been what's happened with quality, safety, testing and the advancement of innovation and delivery transformations.
We will improve quality and we will improve safety at the same time. So there's win-win on all parts. I think too long physicians have been on the sidelines, and I think Choosing Wisely is an example of them actually owning and taking responsibility for removing waste. And I think it's something to build on to really advance our agenda of improving quality and safety.
To me, this is the moment that the incentives are finally aligning to start putting more resources towards patient safety. How do we think about really creating a safe environment for our providers, physical and psychological, so they then can deliver the best care to patients?
Nurses are critical to patient safety. This isn't like, Leah says this, I know, this isn't like a side issue, it's a core issue in patient safety. They, of course, are on the front lines, we know that. We need to make sure they have the training and skills, and I'm suggesting that we are having more of that. I think there really is a value around transparency and saying this is our job. We need to step up and urge our hospitals to be part of the surveys that they need to be and in reporting quality for patients. But we also need to make sure hospitals and other providers out there are listening to that front line and in any way they can. You need the right numbers of nurses, you need the right skill set of nurses, and you need to let their voice be heard very seriously in order to get to patient safety.
I feel like we're in our infancy in how we use technology in healthcare, and the analytics that we use are like kindergarten level. And if you go to, you talk to engineers who are at the PhD level, and we are so far away. But there's more and more of that engineering and analytics coming to healthcare in terms of the predictive analytics, big data, et cetera. So I feel like we're on the cusp of really doing some new and innovative things there to optimize our use of the data that we're going to be getting.
Our agenda for transparency and the idea that people ought to be able to shop for healthcare the way they shop for other kinds of goods and services, the moment for that has truly arrived. We believe that in health policy in the United States, safety should come first, and it does not currently. It is not really coming first in any of the current national policies. It's an interesting sideline in many policies we see, but it is not safety first everywhere, and it's Leapfrog's intention that it will come first. It's our wish, and we're going to make it come true, because 1 in 4 people admitted to a hospital suffer some form of harm upon admission. 1 in 4. That means it should be a national priority. 1 in 4 is an extraordinarily high rate of harm, and it's simply something that has to be on the front burner. This must be the priority. And that in many ways, we have common ground with healthcare workers, and that we at Leapfrog need to stand with healthcare workers, and that we need to be recognizing that all of us have a common cause in improving the healthcare of our country, that the systematic problems in healthcare are affecting not only the patients and the purchasers, but also the people who work in our healthcare system.